Hi, I'm Dr. Joanne Inman. I was the Programme Director for the Cheshire Mersey Nursing, Midwifery and AHP Workforce Development Programme, and also I was the lead for this piece of work alongside Brian Green and Lisa Ellis. Well, originally it came from some work we did to underpin the programme. And what we wanted was an authentic workforce development programme. And so based on what our local intelligence told us was needed. So we surveyed out our frontline nurses, midwives and allied health professionals to find out what was it they wanted, what would support them the most to really thrive in their roles. From the feedback that we got, there was an overwhelming ask around continuing to develop really in the area of practice that they loved, so their clinical or professional area of practice that they really loved. How could they keep developing in that area? And so we decided to bring together some development in terms of leadership and also in terms of quality and improvement, and bring those two things into the one place to enable that to happen. Well, it linked back to the NHS People Plan. To really support more nurse clinical leaders, more allied health professional clinical leaders, to move forward and step into more of the senior roles so that it was even more reflective of the overarching workforce. To do this, we recognised that we needed to support people not just with their leadership development, but also with their ability to really drive quality improvement in those areas of practice that they absolutely loved working in. The programme was developed for nurses, midwives and allied health professionals. We didn't put any specification as to what banding someone needed to be, what job role they needed to be. And actually, in reality, it was really lovely that the people that came forward to be on the programme, there was a real mix of nurses, of allied health professionals, we had social workers, a pharmacist. And so sometimes when you're confident to be able to not put too many barriers around things or parameters, it can just kind of show you the richness that can come up through those different conversations. I think sometimes there is a perception that leadership only happens at a very senior level, and actually it happens at all levels. And so we felt that if we developed a programme which was about leadership, which was about making care even better, that if people saw what the programme was about and they felt that that would help them further develop their practice, we would be open to them kind of being part of this pilot. I think my personal highlights were our ability to come together and be a team, to co-create and co-design and then co-facilitate this programme. There's something really quite magical about different organisations from across Cheshire and Mersey coming together to do that. We also linked in with NHSEI, the Leadership for Personalised Care team, and with our local HEIs. And I think for me, it was fabulous to see that taking that strengths-based approach and really working as a team, what the possibilities are when you take that approach. And then the highlight for me has been seeing the people that came on the pilot, how they have grown through the programme in terms of their confidence, in terms of the projects that they have led, and also how proud they appear to be for the work that they've done, which for me was actually where we started right at the beginning when we were thinking about, well, we want to support people to thrive in terms of their leadership, but also in terms of really taking their area of clinical practice forward and stepping up into those kind of leadership positions. I hope that it gives them the confidence to continue on their journey to be authentic leaders, to be true to their values, to take that strengths-based approach, to really embed co-production and person-centred care central to all that they do, and that this is just a starting point for them to continue to grow as leaders, and their ability to go out there, not only lead quality improvement, care quality improvement themselves, but also to enable and support other people to do that as well. It's quite powerful when you're getting a room, or it was quite powerful for me, being in the same space of most of the participants when they shared their journeys and what the work that they had done. And things have already started to improve in terms of the quality of care that's been provided, because a true quality improvement project has a measure of what was the standard before and what was after as well. So I hope that will really kind of continue to help improve that quality of care that people experience in Cheshire and Mersey. This was a pilot programme. We had a lot of people saying that people wouldn't have capacity to be involved in this kind of programme. We're in the middle of a pandemic, but we gave it a try anyway. And we went out for expressions for interest during the Omicron strain of COVID. We had 30 places on the programme, and we filled those within 10 days. And I actually had to double check that was correct, just because the situation. So I think I was really impressed at how important it is for those people working in Cheshire and Mersey to really deliver high quality care, that is still there despite the pressures under people and despite all of that. So that gives me a lot of hope about what we're doing and how we're doing it. I'm most proud of our ability to work as a team when most of it has been virtual, and to be able to have like a constructive critical debate about how best to do things, because I think the best teams are able to do that, to move things forward. And I'm just really proud of the people who come on the programme and how much they've grown.